Cultural sensitivity interview. Cultural safety centers around the idea that the person receiving care decides whether they feel culturally safe in the healthcare system. Do you believe that this is possible today, given the current culture of healthcare?
Well, we have a long way to go. Why? Because times are changing. For example, being gay is socially acceptable. It wasn't many years ago. There are older age nurses who still think the same way. They've been practicing for so long, it's hard to change their mindset. Young teenage mothers who aren't married come into the healthcare system to have kids, but they don't feel safe because they know they're being judged. Whether it be because of their age, race, marital status, etc. The immigration in Canada has increased over the years, so we're seeing a lot of different people coming into the healthcare system. They receive healthcare, and they are people of all different walks of life. These people are coming to work for the healthcare system too. With all of these changes and diversity happening in Canada, there isn't enough education for healthcare professionals to help them understand that we are all different, and that we all must ensure that no matter our differences, respect should be mutual when providing healthcare.
Can you describe a situation when culturally safe care was provided? Can you describe a situation when it wasn't?
Well, I had an unexplainable pain. I was an 8 out of 10 and I was treated poorly. My pain was the issue, but I was treated like it wasn't. Now, I understand you must wait to be seen, but once seen, I was treated like a drug user. When I was there, my child was sick, I was treated better. My appearance also affected the way that I was treated. When sick and pale and undressed, nobody batted an eye.
Based on your working experience, do you believe there are enough resources in the system to provide culturally safe care? Or are those resources, as well as time, lacking?
No, there is not. Hospitals are small, families are big. Nurses get annoyed when a patient's family visits in the hospital. People feel judged. I know this from experience. There isn't any privacy. Families eat together. It's therapeutic. And family members, they don't want to leave their loved ones alone in the healthcare setting. Visiting hours are short, and most times overnight stays are forbidden.
Yes. So what kind of changes do you think should happen in order to make the healthcare environment more culturally safe?
Well, more privacy for families. Offer a place for them to practice their beliefs and not just a church. A room where families can go and pray to whoever they pray to. Families need to be more involved and patients need to be more encouraged to practice their cultural beliefs, especially when they're in a vulnerable state.
Okay, so can you describe what your workplace does to acknowledge cultural differences for both staff and people in care? So, for example, there's a First Nation Healing Center, different events, materials, courses available.
We have a sweat lodge here and healing ceremonies. Anyone is welcome to take part. I think the hospital on treaty land is perfect for a sweat lodge. People need spiritual healing as well. There are also elders who come and speak with people, not just the patients, but their families as well.
Oh, of course, absolutely. So do you think cultural safety is a good idea and goal worth striving towards in the healthcare system? Why? Why not?
I think it divides the population more, but I also think that it gives people a sense of identity and a right to practice their practices and feel safe while being in the healthcare system. The healthcare system should focus holistically on a patient and not just on the illness. Healthcare professionals need to be aware of their own culture, be sensitive to others, and aware of the changes that are happening in this country. The more acceptable professionals are, the more safer healthcare system may feel to others, including me.
Right. Is there something specific you think the healthcare system should focus on in order to reach the goal of being culturally safe for all?
Education is key. Start teaching more about cultural safety in programs while these people are still students. That way they will be required to reflect and at least think about all the issues that are happening all over Canada.
Very well said. So do you think there's anything that the general public can do to work towards the same goal of achieving cultural safety?
I think it's important to go into the healthcare system with no preconceived ideas of how you're going to be treated. Not every experience will be a bad one. Things aren't always what they seem. Consider how busy healthcare professionals are. They have priorities to take care of. Healthcare professionals are people too. They have their bad days as well. Practice your patience.
Yes. So, do you ever hear colleagues or other employees making rude remarks in front of or near patients that may be offensive and make them feel unsafe?
I have heard comments, yes. I have also seen the patient change their attitude and shut down in front of the healthcare provider. Not good.
Do you think that society is somewhat in denial of the inequalities that we face here in Canada in regards to the healthcare for minorities?
Well, yes. When you are not a minority, you cannot sympathize with one. So you really have no idea how they feel or what they go through. And you can't see a problem, but it's not your fault.
Yes. Okay, well, thanks for your time. I had a lot of fun today doing this interview with you, and I really appreciate it.
Yes, well, you're very, very welcome. Anytime. Thank you.